I'm Kalaivani, Assistant Professor working in SNS College of Pharmacy and Health.
Group activity based on a case, that is designing a vaccine launch strategy for an emerging market. Okay, ma'am. So objective, this is to help you understand the complexity of launching a vaccine in emerging countries and explore creative solutions for overcoming real world challenges. Okay, this should be a group activity, and girls one group and boys one group. We can split it up, and here are the instructions. That is, you are going to be in a one group. Girls, we can name it as A group, and boys, we can name it as B group. And here each group will act as a public health strategy team for launching a new vaccine, for example, malaria, chikungunya or Zika in an emerging country. Okay, and each group should outline the target region and its disease burden, a plan to flip the model, how they will start in that market, and key stakeholders they will engage, that is who all will be engaging in your key stakeholders. As a key stakeholders, government, non-governmental organizations, pharma companies, community leaders like that, as political leaders like that. So who you are going to take it as your stakeholders. And strategies for financing, distribution and community awareness, potential risks and mitigation plans. And each team should be talk at least for 2 minutes or 3 minutes for your presentation, and debrief, discuss how their strategies reflect or differ from Sanofi's dengue vaccine case, emphasize lessons. That is, we studied about dengue vaccine case study, right? So Sanofi வந்து ஒரு பிளான் வச்சிருக்காங்க. அந்த பிளான் வந்து how you are going to differ or how you are going to use your strategy to win the Sanofi marketing plan. Okay, then so we girls team, A team, we have discussed on the topic Zika. So I am here to explain about the target region and disease burden and flip the model techniques or strategies. So the Zika has been particularly seen in most of the northeast Brazil, like states like Pernambuco, Bahia and other places. So Brazil was the epicenter of the 2015-16 Zika outbreak linked to microcephaly and congenital Zika syndrome in newborns. So as of recent years, these outbreaks continue due to the presence of mosquitoes also transmit dengue, also chikungunya. So urban slums with poor sanitation and standing water are at high risk. ஸோ இந்த மாதிரி டார்கெட் பிளேசஸ் பிரேசில் அப்படின்னு ஒன்று எடுத்துக்கிட்டோம் அப்படின்னா, ஃபர்ஸ்ட் இதுல ஃபோக்கஸ் பண்றது வந்து டிசீஸ் அவுட் பிரேக் வந்து கண்ட்ரோல் பண்ணலாம். அதுக்கப்புறமா வந்து அதர் ஸ்டேட்ஸ் போகலாம். அண்ட் பப்ளிக் ஹெல்த் ப்ரையாரிட்டி இதுல என்ன இருக்கும்னா, ப்ரிவென்ட் அனதர் மேஜர் அவுட் பிரேக், ப்ரொடெக்ட் பிரெக்னென்ட் விமன்ஸ் and newborns and strengthen vector control capacity. ஏன்னா as of census, newborns and pregnant women were affected more due to Zika in Brazil. So flip the model, இது வந்து ஒரு innovative market entry approach. இதுல வந்து traditional model என்னன்னா, government led top down campaigns focusing mainly on mosquito spraying and reactive responses after outbreak occurs. The flip the model அப்படின்றது வந்து community driven prevention program or digital surveillance, empowering local women's groups or health volunteers to lead the response. இதுல வந்து எப்படி we can flip the strategies அப்படின்னா, community led surveillance like using mobile apps or WhatsApp bot, அந்த மாதிரி இதுல வந்து we can share the data or local health authorities on the we can give the reports and we have to share the data. Targeted prevention for women, so especially women's and pregnancy women's newborns எல்லாம் வந்து affect ஆனதுனால we can distribute mosquito proof pregnancy kits or repellents இந்த மாதிரி. Micro enterprise models like encouraging local business to produce and sell low cost repellents, and pilot start launch in high historical or outbreaks இருக்கிற இடத்துல வந்து we can start pilot plans அந்த மாதிரி. So further will be explained by Mike. So hi everyone, I'm here to explain about the key stakeholders and the strategies for planning about the vaccines in the implementation of Zika virus vaccine. So key stakeholders we mainly focus about on the government health ministries, in which if they provide the advertisement for the vaccine, it will be more public opinion for to adopt the vaccine, and we will be distributing it from the community and religious leaders to build and trust the trust about the vaccines. Now, strategies for financial and distribution is like distribution will distribute it to the local health clinics and ensure cold chain availability in tropical regions. Community awareness is about through local channels, the WhatsApp channels, and to the radio channels. Now, coming to the conclusion of the implementation of Zika virus vaccine, our team proposes the Zika virus vaccine first in Brazil and Thailand, focusing on reproductive age women and the pregnant women. Like with the help of WHO and local NGOs, we'll fund the campaign through Gavi community and partnerships. Thank you. Even to the Zika vaccine is Zikora, in which we are inspired from the American name, which is meaning to show the world, suggest hope and visibility.
We boys discuss about the malarial disease for the vaccine, and here is an example. The target region for the vaccine, the name of the vaccine was Malvax, a malarial vaccine designed for children under 10 years old in Ghana, a country in sub-Saharan Africa where malaria remains endemic. Launch plan, region and disease burden. Malaria is responsible for 12 million cases annually in Ghana. Rural and forested regions experience the highest transmission rates. Plan to begin rollout. The program will start in 3 high incidence regions: northern, upper east and upper west. Initial rollout will target children through existing immunization clinics. Key stakeholders, governments, NGOs, pharma partners, community leaders. The upcoming topics are discussed. Stakeholders.
Key stakeholders: government, Ghana Health Service and Ministry of Health, NGOs, WHO and UNICEF and PATH, pharma partners, GSK manufacturers, local cold chain logistic providers, community leaders, chiefs, school administrators and religious leaders. Strategies for financing and distribution and awareness. Financing, global vaccine alliances and World Bank support. Distribution, integral with national immunization days using existing cold chain system. Community awareness, radio campaigns, posters in schools and door-to-door education by health volunteers. Potential risk and mitigation plans. This depends on public mistrust and misinformations, mitigation, transparent communication and involvement of local leaders. Our approach reflects lessons from the dengue vaccine case by emphasizing transparency, phased rollout, and informed consistent. We aim to maintain public trust through open communication about safety, affordability through Gavi funding, and political support via local government involvement.